Good day, ma'am. I am Salinda from BSN2F Cluster A Group 22, and I will be presenting and interpreting the activity that you have given to us, which is the Partograph. So, Partograph, it is a graphical presentation of the progress of labor or of the fetal and maternal condition during labor. It is the best tool to help you detect whether the labor is normally progressing or abnormally progressing, and to warn you as soon as possible for um, if there are any signs of fetal distress, or if the mother's vital signs deviate from the normal range. So the name of the patient is Mrs. Laila Manuel. Gravida 2, Parity 1, date of admission is October 1, time of admission is 10 a.m. For the first part of the partograph is the recording of the fetal heart rate. So the normal value of the fetal heart rate is 120 to 160. So as you can see here, during or prior to the admission, it is 140, so meaning it is normal. For the status of the membrane and the amniotic fluid, it is still intact. And then after 4 hours, um, the fetal heart rate drops from 140 to 1 140 to 130, which is also normal. The membrane is ruptured and the color of the amniotic fluid is clear. And for the next 4 hours, um, the fetal heart rate drops from 130 to 100 beats per minute. So meaning it is not normal. And for the amniotic fluid, it is meconium stained. For the molding, it is plus 2, which means there is an overlapping of the bone, but it is irreducible. So these signs can be an indicator of fetal distress. So for the next part of the partograph is the um, cervical dilation and the descent of the fetal head. So as you can see, prior to the admission, it is 5 the cervical dilation is in 5 cm, which is normal. But however, after 4 hours, the cervical dilation crosses the alert line and it is in 7 cm, which is not normal. And for the next 4 hours, it is still in the 7 cm, which is not normal, and it also crosses the action line, which is not normal. And it can be, or if it is crosses, if the cervical dilation crosses this alert and action line, then it can be, or a decision or a intervention can be made, like augmentation of labor or cesarean section. For the descent of the fetal head prior to the admission is at 5 cm. Then for the next 4 hours at the 3 cm, next 4 hours, after 4 hours, um, 1 cm. So the progress or the descent of the fetal head is not normal for multipara, because the normal descent of the multipara should be 2 centimeter per hour. So all of this, or because of this progress of, or abnormal progress of this cervical dilation and the descent of the fetal head, um, there is a drop in the fetal heart rate, which um, can be an indicator which indicates fetal distress. For the next part of the partograph is the contractions per 10 minutes. So as you can see, for the contractions upon admission, there is a 3 contraction per 10 minutes, and each lasts for 35 seconds. For the next 4 hours, there is 4 contraction per 10 minutes and each lasts for 45 seconds. For the next 4 hours, there is 5 contractions per 10 minutes, and each lasts for 55 seconds, which is normal. For the maternal vital signs, the um, pulse rate upon admission is 88 which is normal. The blood pressure is 120/70, which is also normal, and the temperature is 37 degrees Celsius, which is normal. For after 4 hours, the pulse rate increases from 88 to 90, which is also normal. For the blood pressure, 130 to 70, which is elevated, and for the temperature 37 degrees Celsius, which is normal. For the pulse rate after 4 hours, it increases from 90 to 100, which is also normal. For the blood pressure, it increases and it is in 130 or 140/80, which is high. So it can be an indicator for preeclampsia or pregnancy-induced hypertension. Then for the temperature is 37.5 degrees Celsius, which is also normal. For the urinalysis of the patient, there is a presence of protein in the urine. As you can see here, positive protein. So it can also be an indicator for preeclampsia or pregnancy-induced hypertension. Then the urine volume is 200 ml. So that's all for the um, interpretation of the partograph.